Our next presenter is a registered nurse, has a degree in psychology, and like myself, is a regional overdose prevention specialist. She is my counterpart for Shelby County. She says she is the number one ropes in Tennessee. I, of course, say she is the number two ropes in Tennessee. Her name is Jill Carney, and she's going to be doing a Narcan training for you. Jill, are you there? Can you hear me? I cannot hear you. All right, y'all, we're doing pretty good today. This is the first technical issue that we've had so far. See how this goes. Y'all hang tight for 1 second.
Unmute. Can you see me?
I can see you and I can hear you.
Can you hear me? That was crazy. I'm so sorry. It just went to my calendar for some reason and took me.
I was just introducing you as the number two ropes.
I don't think you were. I heard you. I was on there. It was. I saw it. Let's see if it'll let me share my screen and get started. I'm sorry for that. No, of course it's not. All right. Now, can you see that?
You can. All right. It's all yours.
Okay, thank you. Number two ropes. So he told you who I am. I'm Jill Carney, and I work as a regional overdose prevention specialist for the Memphis Area Prevention Coalition. And before we do anything, I am going to ask you to please do this QR code and do an evaluation for me after the training. It's not the evaluation that you guys are doing to get your CEUs. It's an evaluation for me that I have to do. I have to have those too. Can you all see that? Okay. Josh, I can't hear you anymore. Can you still hear me?
Yeah, you're good. Yeah, we can see everything.
Okay. So my training objectives, I'm going to tell you about what opioids are, which most of you probably know what they are. You wouldn't be doing this conference. The risk factors for an overdose, a little bit about harm reduction and reducing stigma, the addicted brain, which I would like to talk about this whole time, and recognizing what an overdose looks like and using some naloxone and reversing that. So, and a little bit about compassion fatigue. But we've heard about most of these things today. The main part I want to get to is the training. So what are opioids? And if nobody's talked about that yet, these are some: codeine, morphine, oxycodone, which is Percocet, OxyContin, Opanas, methadone, hydrocodone, which is the Lortab, hydromorphone, which is Dilaudid, fentanyl. That fentanyl is different from the fentanyl that we are getting on the street. That is pharmaceutical grade fentanyl, and that is actually a great drug if used in a hospital correctly. And buprenorphine, which is like Subutex and Suboxone, which is a lot of that's MAT. I added this picture. It's not on the state approved slide, but I think it's really important because that is a lethal dose of heroin, a lethal dose of fentanyl, and a lethal dose of carfentanil. And if you can just imagine a few grains of salt That is all it takes to kill somebody. And that is what is happening in our city right now. And that is why all these people are dying, because they think they're getting one thing and they're getting another. And it's too powerful and their bodies can't handle it and they die. So, and what is an opioid epidemic, which is what we are in? We're in a pandemic in the middle of an opioid epidemic, which is an absolute nightmare. Every day, more than 130 people in the United States die from an opioid overdose. That is a lot of people. In 2018, more people died from an opioid overdose than car accidents in the United States. And the CDC estimates that the economic burden of prescription opioid misuse is 78.5 billion. And obviously, that's a lot of money from jobs. I mean, from people not going to work, jobs lost. That includes, endocarditis and abscesses from IV use and all sorts of treatment, all sorts of numbers. I have some current numbers, but these numbers are from 2018. 6 million people in this Tennessee? Yeah, in Tennessee, were given a painkiller prescription, and that is enough for almost one prescription for every man, woman, and child in Tennessee. In 2018, 1,304 people died from an opioid overdose, and the current rate is 19 per 100,000. I think that's probably higher now. And I can't see all of. I'm gonna have to move this over a little bit. Okay, whatever. A 975% increase, and that I know that. I don't even know how that could go higher, but it's higher. This is really important, and this is the current numbers for Shelby County. We've had 1,353 emergency visits for suspected overdoses, and we've had a reported 2,836 suspected drug overdoses. That the 1,300 is opioid, the 28 is possibly other things too. And that shows you also a breakdown of race and age. So the highest population is 30 to 39, and Black males are the highest overdose rate, followed by white males, and then Black females, and then white females. And that has all changed in the last 2 years. Used to be the largest number was white males. And this is the current death rate in Shelby County so far this year, which is 315. And Josh, you might answer this. Did we end up with 216 overdose last year? Are you still there? You might not be there anymore.
Last year we ended up with 341 total overdoses. I'm not sure how many of them were
opioid,
but I know we were on track to beat it this year.
About that. So, and we had a really big spike, obviously in May from, David talked about that with the numbers, with the stimulus checks or the economy boosting checks, whatever he said he wanted to use as his terminology. But if we get another one, we expect a higher one. And also last year, between Thanksgiving and Christmas, we also had a spike. And I don't know if that was related to depression. We don't ever know, if it's that. We assume that the influx of money in the lack of AA meetings, NA meetings, and the isolation was a huge part of the problem and the spike that we saw in May. But this year has been just a horrid year, depending on how this election goes, coupled with families all getting together for Thanksgiving and Christmas, and depression being higher that time of year anyway. Our rates could go a lot higher. So obviously I'm giving you Narcan training, and you have the opportunity to pick some up tomorrow. But if you can do anything except for pay attention and communicate with those people that you love and watch, that's what we need a lot of. So Josh, can you tell me how to get this off of, wait, hold on. How do I make it me smaller so that, oh, there. Okay, I couldn't read it. Sorry. Okay, 2020 overdose data. I got this actually from Tony, who spoke to y'all yesterday, for the whole state, and I snagged this from some Tennessee Department of Health information. I thought it was important for us to know. According to the latest numbers for our drug overdose reporting system for the first half of 2020, non-fatal opioid overdoses are up over 20% compared to last year. While we have typically seen an increase in overdoses heading into summer, this year's numbers are particularly alarming because fewer hospitals are reporting, and we have seen fewer ED visits statewide, both due to COVID. The true number of overdoses is likely to be even higher. And I will say, too, I didn't know this until David was talking, but he said the fire department hasn't been reporting accurately since the middle of August. So those numbers that I just showed you aren't probably as high as they really are. Okay, now let me do this. Recent data underscores the continuing need for these life-saving efforts. Sadly, the state's overall number of deadly overdoses continues to rise, and the trend has continued in recent months as the state has been confronted with COVID. There were 2,089 Tennesseans who died from drug overdoses in 2019, a 15% increase in overdoses from 2018. Tennessee also saw increases in overdose deaths associated with opioids, fentanyl, and stimulants. And so I'm a regional overdose prevention specialist, as is Josh. And we are located in 13 regions across the state. There's 22 of us, and Josh and I are down in that little corner, and we are in charge of Region 7, which is Shelby County. And we work for the Save a Life grant program, and we have distributed across all those regions 1,600 units of naloxone since we started in October of 2017. That's a lot, and 12,000 of that is us in Shelby County, which I'm very proud of, which we did not do alone. We did with a lot of help from a lot of our partners. And naloxone has saved over 16,000 lives in Tennessee, and that number is so much smaller than it really is. We know that I personally, I'm in recovery, and I personally used it 7 times that I didn't report in the past. This before I became a regional overdose prevention specialist. But a lot of people use naloxone and don't report it, and because they don't want the police to come, or they don't want EMTs to come because the person is breathing again. We always recommend you call and get help. But that being said, a lot of these numbers aren't reported, and so a lot of lives are being saved that we don't even know about. Because of COVID, we are doing virtual trainings like we're doing right now, though I will come to you with wherever wearing a mask and social distancing, as will Josh. And we have done in face-to-face social distancing trainings at churches. I just did one at a school yesterday, so we will do those as well. And tomorrow we're going to implement the no contact Narcan distribution. We're going to set it on the table for you, and you can pick it up along with your certificate at St. John's between 10 and 2. We can also do that at a different time if that's not convenient for you. And we have been doing that since the epidemic started. As it gives you examples here, put it in your mailbox, put it on the hood of your car. And there's also a Tennessee Recovery app that you can download. I have the number for that at the end of this. And we've been doing webinars and all sorts of fun stuff. COVID has made us very creative. So harm reduction, which Allison just talked a lot about, is another way of doing harm reduction, which is meeting people where they are, is Narcan trainings. SSPs, Narcan trainings, MAT, that's all forms of meeting people where they are. It's a non-judgmental approach. It's realizing that people don't always get sober when you want them to, don't always get sober and stay sober. There's a complex social factors influencing that. And we want to empower people to be the primary agents of reducing harm in their own lives, but we're there to help them however we can. And Narcan training is just one of the ways we do that, and I'm very proud to be able to help do that. This is showing you one of the ways we do that. We call 911. We get them a medical attention. We assess if treatment is needed, wanted, and where we can get that. And we start having conversations about overdose prevention, naloxone, and safer drug use strategies. SSPs, that you just heard a great commercial from Austin, and I'm going to give you another shot of where they're located for us. They're community-based public health programs that provide comprehensive harm reduction services, and there's a list there. And we have really, in the last year that we've been doing this, Austin in particular knows every single client by name, sometimes knows their numbers. We've had people waiting for us before we even got there, wanting to go to treatment. We have caps there, and Chris Moore is there every week. If you want to go, he'll take you right then. And we have HIV and Hep C. Well, we're doing Hep C testing starting soon, but we have currently HIV testing on site, and we're just there to help. And it's been awesome. Reducing stigma. Over 50% of opioid prescriptions for Tennessee were for pain using insurance. And this slide is just there to tell you that a lot of people start with opioid addiction, as did myself, with an injury. And you start on medication given by a doctor, and it all is on the up and up. And you, the longer you take any opioid, the higher your tolerance gets. And that is not whether you're an addict or not an addict, that happens, and you need more and you need more. And those of us born with the gene, it can take off and start. You can become powerless to it. So this is just talking about reducing stigma and realizing that not I believe no one chooses to be an addict, but the way that people get addicted can sometimes be as innocuous as pulled tooth. So the addicted brain, like I said, I could talk about this all day. I think Dr. Bilbrook talked about it a little bit. And Tim Hilton usually comes here in March through Bradford. And if you ever have a chance to see him via Zoom, or if he comes, it is a wonderful 2 hours of him explaining the addicted brain and how the step one of a 12-step program is that you are powerless, that your life has become unmanageable. And for a long time, I personally thought that it was a moral failure, that I wasn't strong enough, that if I was really a good person, that I could stop for my kids, for my family. And I am a nurse, and I knew it was a disease, but I could never really separate what I knew from what I was living, and not separate, conjoin those two, and realize that the structures of my brain were changing, and I had truly lost the power. Every day I take a lisinopril for my blood pressure, and I don't think twice about what I eat, I don't exercise enough. I just have genetic cardiovascular disease. And through the 12 steps of, for me, AA, I have learned that I need a meeting. I need to call my sponsor every day, because I have a chronic disease that I'm treating, just like I take my lisinopril to treat my blood pressure. And if we could ever get to the point where we had no judgment on that, even as addicts, that would be a beautiful thing. The pleasure principle, that the brain registers all pleasure the same way through dopamine. Whether you eat sugary foods, or you take a Lortab, or you smoke crack, or you drink a glass of red wine, you have a conditioned response to that flooding of the dopamine, and your brain actually remembers that. And as you use substances, they become they change the structure of your brain, and you become literally powerless to what your brain tells you. And to explain that to somebody that's in the throes of any sort of addiction is a very difficult job. And that's why staying sober is not always the easiest thing to do, and relapses happen. Other things that affect being sober and staying sober are ACEs, adverse childhood experiences. Your score on your ACEs can sometimes, well, not sometimes, individuals are 4 times with a 4 or more of ACEs are 12 times more likely to attempt suicide. With a 5 are 7 to 10 times more likely to use illicit drugs. With a 6 are 46 more times likely to be IV drug abusers than those with no ACEs. It's pretty powerful data. And again, looking at people and thinking, when you see those guys out on East Parkway panhandling, if you look at them and think that guy had a 46%, 46 times more likely to have an ACE score higher than 6 in my head, instead of thinking that dude just wants my money. It's a way to change the stigma and understand what we're dealing with a little better. Risk factors for an opioid overdose. This is important information again. After a period of no use. So if you use any sort of opiate over a 3 to 5 day period, you become tolerant to it and physically dependent on it. After a period of no use, your brain actually goes back to zero, where you don't have a tolerance at all. But if you are an addict, most likely your brain doesn't register that in your thinking. And so if you are to use again, be it you get out of jail or you get out of detox, or you relapse and use again, you don't really think in your head, even though you might know I don't have a tolerance, you don't think about it in the terms of, hey, I'm going to use this heroin, I better use a little bit. Or this heroin might not be heroin, it might be fentanyl. People are listening to I'm going to use as much as I did last time. I'm going to get really high. I just got out of jail. I deserve this. And their bodies cannot handle it. Mixing opioids with any kind, tolerance or no tolerance, any kind of alcohol or benzo, Xanax, Valium, Ativan, you're much more likely to overdose. If you've ever overdosed before, you're more likely to overdose again. Using it by yourself. Obviously, nobody can give you CPR, call 911, or give you Narcan if you're by yourself. And those with a history of mental illness, chronic illness like pain or cancer, and a methadone prescription. Those are all risk factors for an opioid overdose. And suicidal ideation. What causes an overdose? Opioids affect the brain's regulation of breathing, and they perfectly mimic the body's natural transmitters, allowing them to fit exactly on the brain's receptors. Once attached, opioids block pain and they slow down breathing, and they occur when too many opioids attach, causing your breathing to stop. I kind of think of it as this. So you take some fentanyl and it floats and it locks onto that receptor, and the brain, all the receptors start getting flooded with fentanyl, and the part of your brain that's located in your brain stem that reminds you to breathe without you even thinking about it, it literally shuts off. It's not like, you do slow down in the effects of it, but it's not like you just are drowning. It's like it stops. It does not know to breathe again. So you can't like shake somebody or pour water on somebody and make them wake back up if it's an overdose. It's a literal, all the receptors are flooded. There's no way without those receptors being blocked by naloxone that they can start breathing again on their own. So that is that. Recognizing an overdose. This slide is talking about being over medicated besides being overdosed, which is what I was saying. If the brainstem is totally shut off, that means it's a true overdose. Loss of consciousness, unresponsiveness to stimuli, your breathing is very slow, erratic, respirations less than 6 a minute. A choking or gurgling sound. If you listen to rap music, Little Peep, he was literally drowning for about 12 hours on his bus. People thought he was like snoring really loud. He was drowning. Vomiting, your body's limp, face is very pale or clammy, fingernails are blue or purplish, and your lips the same color, and your pulse is slow or erratic. The 7 times that I used this in the past, the person I used it on literally looked embalmed. I mean, there was no doubt that he was overdosed. He was purple everywhere. There was no need to do a sternal rub on him because he wasn't responsive at all. The part that that the nodding off and the over medicated, you can use Narcan on somebody that's over medicated. They're just going to be angry, that you've put them in withdrawal. But you don't have to wait until somebody is completely overdosed to use this. That is important information for me to let you know. People have thought that in the past, and there's no reason to wait until somebody's dead to get this on board. If you have any, if your kid comes home, they're 16, and they told you they took something, or you see them and they look, obviously out of it, give them some Narcan. You're welcome to do that. They can happen slowly over the course of several hours, which is what happened with little Peep, or they can happen quickly. What is naloxone? It does result in somebody going into temporary withdrawals. It is not possible to overdose on. It has a stronger. It's a medication from God. That's what it is. So you can see those little balls on there. So let's say that fentanyl's on there. They float. The fentanyl floats up and down on top of those receptors. When it floats up, that the Narcan has got a stronger affinity to that receptor than the fentanyl does, and it locks on there and it blocks it. So when all that fentanyl is floating up and that naloxone gets on there and blocks all those receptors, you get an pretty instant reversal of that overdose. You can't use too much of it. If it's a stroke, it's not going to hurt. The only thing this drug does is get somebody breathing again that's overdosed on an opioid. That's it. It only blocks opioid receptors. It doesn't change your blood pressure, your sugar, nothing like that, unless you're overdosed. So you can't hurt anybody that you give naloxone to. If your 4-year-old is overdosing, it's the same dose, the same drug. You give it. And if you don't know what the person took, it's not going to hurt them. You can give it. It's not going to work on benzos. It's not going to work on alcohol. That person I told you about that I used it on, when I reversed him, he was still drunk. He was still on marijuana. He was still on cocaine. He was still really messed up, but he wasn't on opiates anymore. He was breathing, and he was in withdrawal from opiates. Was not feeling good. So it reverses the effects of opioids by binding to those same sites. It's more powerful than the opioids. It is the only successful way to reverse an opioid overdose, and it only knocks them off for 30 to 90 minutes. So that's important to not leave anybody alone that you've given naloxone to. In that same situation, that same person I was talking about that I Narcaned, one, he would not go to the hospital, and two, I'd put him in withdrawal, and he felt horrible. He wanted to use again. Making sure that they don't use, and making sure that they understand that if they use while the Narcan's on board, they're not gonna get high. And know that they're probably about to overdose again, and you can Narcan them again if they overdose again. If they sneak off and say they're going to the bathroom and they use again and they overdose, hit them with some more Narcan if you have it. That's what the MTs are going to do when you call them. Narcan comes in a variety of different ways. The intramuscular, that's what I used back in the day. It is given in the outside of the thigh if you give it with a shot. The same thing with the auto injector Evisio. It actually talks to you kind of like an EpiPen. You pull off the end and you put it in the outside of their thigh, and it auto injects in there, and it tells you what it's doing. And then I've never seen the nail atomizer on the far side. You screw it together like an EpiPen as well and shoot it up the nose. But the one that we're gonna give you in this little kit is the one in the middle that says Narcan. And all you have to do with that is spray it up their nose. Very easy to use. Naloxone misconceptions. There's no evidence that giving people naloxone is going to make them use more drugs. It does not one thing but keep them alive. It does cause withdrawal, which is painful and unpleasant. And research shows injection drug users trained on naloxone reduced use over time and increased knowledge and overdose response behavior. We heard stories of naloxone parties in Middle Tennessee where people were trying to get as high as they could and then Narcan themselves. That is insane to even say. Nobody is going to spend money on drugs and hope they get to a point of death, which they're not going to remember after they pass out, so that they can be Narcaned and put in massive withdrawal. Nobody's going to do that. Certainly not an addict. So that is a total misconception, and I think was just fake news. So myths to reversing an overdose: do not put the person in a cold bath or shower; they could drown. Their gag reflex isn't going to work, so you don't give them anything to eat and drink. Anything when you even Narcan them and they sit up and they start talking to you again, you still don't give them anything to eat or drink, and you certainly don't pour water over them. This has been done, obviously, or it wouldn't be in the state slide deck PowerPoint. So this has been tried. Do not inject a person with any other substance, such as salt water, milk, speed, etc. And I really did hear from somebody that they heard milk worked, and that who goes, hey buddy, go get the milk. Somebody's overdosing. It's nuts. And it could cause an infection. Do not try to make the person vomit or eat or drink anything. They could choke. And do not give them anything over the counter, such as no-dose or niacin. That also will not help. Responding, what do? We try to maintain responsiveness. Call the person's name. Hey, are you alive? Are you okay? Just like you do in your CPR training. Shake the person, see if you can get a response. If not, you use the sternal rub. You make a fist and you use the middle joints of your fingers, not the knuckles, to firmly rub on the center of a person's chest to wake them up. You can do that with anybody that is non-responsive. It's a stimulus effect that should make them feel pain and wake up. If they don't, you move on to the next step, which is administer naloxone. It's we call it Narcan, but it is that's the non-generic name. So is this going to tell me how to do this too? Yeah. Okay. So naloxone is going to come in this little packet. It's got 2 in there. Do not remove it from the little holder that it comes in. It comes in a little peel pack like this. There's 2 of them. Do not remove it. You need to keep it it's liquid in there because it's a spray. You don't want it to get too cold or too hot. In all honesty, I have one in my car, but I also have one in my purse. But just in case I'm somewhere, I have one in there. And I know a sheriff used it on a guy in court that had it in his trunk. He'd gone out to get it, and the guy, it still worked. But what it says to do and what is recommended is to keep it at room temperature so that it is protected from light and from heat or cold. What you do. So after, I'm going to just do it, what I would do. So I am by myself and Ben falls out and I go over to him and I say, Ben, are you all right? Are you okay? And he's blue and his pinpoint pupils are going, and I freak out. The first thing I want to do, because this takes 2 to 3 minutes to work, is grab my Narcan. Before I call 911 even, I'm going to grab my Narcan so it has a chance to work. What I'm going to do, he's sitting up. When he fell out sitting up like that. I'm going to take him, turn him carefully, lay him down on the ground, and I'm going to tilt his chin back like you do with CPR. 1, because you're opening up that airway, and 2, because when you spray this up his nose, gravity will work so it can spray up and go up into his nasal sinus cavity. So, and I'm going to grab my handy Narcan, which I keep accessible because you can't misuse it or overdose on it. So I have it where my first aid kit is in my house. It's available to me at all times. I got it. I get it. I peel it back. Inside is a little sheet that tells you how to do it in case you forget. And in your Narcan bags is also a little piece of paper that shows you how to do it. It is so easy to do, but I am a cardiac nurse historically. And when it was somebody I loved, everything I thought I knew about CPR went straight out the window. So it is a trauma when it happens to you. So don't feel bad that you go and get this and you pull it out and look at it. You take out your little plunger and you hold it just like this. You shove it up the person's nair, either one, doesn't matter, until your fingers hit the person's nose, and you push it in. and you spray it just like that. And that's what it looks like. There are gloves in here to use as well. I recommend using them. But if you touch Narcan or fentanyl or anything on your skin that's not broken, God gave us this as a barrier. Most likely you just need to wash your hands really good after you've done anything where you're touching somebody's mucous membranes. Um, that's what you need to do. You'll more than likely, unless you have a big cut on you, be totally safe. So don't not help somebody because you're afraid. But you do have gloves right here in your kit, and I do recommend taking the 1 second to put them on. So I've given my first dose. At that point, I'm going to call 911 if I'm by myself. If I'm with somebody, I'm going to say, hey, Josh, call 911. He's got them coming. So that tells you exactly how to do it. After that, you tell 911 where you are, what you did, what you think the person had, and that you gave them naloxone. And then you're going to start CPR. If you don't know how to do CPR, you should go and take a class. It's really easy to learn. But if you are giving CPR, you know that you're just pushing on the person's chest to keep that blood oxygenating all their organs. So, because without oxygenation, the brain starts dying within 6 minutes with no oxygen. So it's really important to start CPR. And the 911 operator will tell you how to do it if you don't know how to do it. So in 2 to 3 minutes, if the person hasn't responded to you, you give the second dose. And the other nostril is what it says in the literature that comes with it, which kind of cracks me up because the reasoning behind that is in case their nostril gets irritated. So that's probably the last thing that they're worried about is their nostril being irritated. So if you don't remember what nostril you gave it in, you can give it in either one. It won't hurt. Every 2 to 3 minutes, you can keep going with this Narcan if 911 isn't there yet, or the person you're with has not responded yet. You cannot overdose somebody on this. So every 2 to 3 minutes, which seems like a lifetime, you keep going with this until 911 gets there, the EMTs get there. When they do come to, you want to turn them on their side in this position. And the reason for that is when you use any sort of an opiate, it kind of slows down your gut, and it's like your pupils get constricted, your mouth gets dry. You don't usually use the bathroom very often. Everything kind of slows down. When you reverse that and you put somebody in withdrawal, all that stuff starts up again really fast. So they could start sweating, they could start vomiting, they could have diarrhea, they could all sorts of unpleasant things could happen. But if you turn them on their side and they do vomit, that way they won't choke on it or breathe it back in. So that's what we suggest. The person that I was with, when he came back to, he did a whole like that. He came back to, and he didn't know what had happened. He was scared. He was in withdrawal, and withdrawal feels like restless legs. Your heart's going 90 to nothing. You feel really, really uncomfortable. Your head's probably telling you everything's wrong. Everything's wrong. I gotta use. So what I did with him is I just rubbed his back and I just told him what had happened. I told him to take some deep breaths for me. I was real calm. You're all right. You're all right. I think you had a little too much. Take a deep breath for me, buddy. You're all right. You might not want to tell them that the EMTs are on their way because it might make them panic. But if you know them very well, you might tell them they're coming. It's okay. You're gonna be all right. When the EMTs get there, you hand them the Narcan and tell them, I think he took some fentanyl, or I think he took some pill that he thought was fentanyl, and I gave him 2 doses of 4 milligram Narcan. You can hand them this. We know that they know that we're out there giving this out, and they're very appreciative that you guys have it and are using it. So stay with them and watch them. If they don't remember and they want to use again, you got to talk them through that. Again, don't leave them alone for at least 2 hours. We do know of 2 incidents where a patient went to Baptist and were released with totally stable vitals, did not use again, according to the people that were with them. And the Narcan wore off in their system and they overdosed again. One of them died and the other one didn't. So don't leave that person alone. and inform the paramedics what they had. And this is telling you all the stuff I just told you. They could become violent. They could have a heart attack if they have a pre-existing condition, and they could experience a lot of leg pain if they're in withdrawal. So be aware. Don't not give Narcan because you're afraid somebody's going to get violent. Though that rarely happens. You are protected from liability from using this on anybody in the state of Tennessee. You are protected by the Good Samaritan law. And also, if in my situation, I didn't call, one, because he was breathing, and two, because I thought we'd get arrested. That is not the case anymore. If it is the first time you have called and they come, you will not get arrested if there's any drugs there. They will, unless you've got kilos of stuff all over the place. They're not really interested in arresting the users. They want us to have people calling, and they want to help. You would not believe the change in mentality in our police force, at least in Shelby County. And I'm sure that doesn't speak to everybody, but the organized crime unit that we work with, they know that this is an illness and they want people to get help. They also are really frustrated when they go 7-8 times the same house, and who doesn't? And blame, I mean, that's totally normal for them to get frustrated, but for the most part, they are the first ones on scene, and they have Narcan to use, and they are trying to get people into care instead of jail, especially with COVID. So how do you get Narcan? With insurance, you can get it, 80% copay, blah, blah, blah. You can also go to GoodRx. You can do that for any prescription, by the way. GoodRx is a great website to use for coupons. And if the person doesn't have insurance or you don't have insurance, you can come get it from us. And our numbers are going to follow soon. But if you get it at Walgreens or CVS, you can bring the certificate from the training that I am doing with you, and you can pick up tomorrow to get it, or they can do a training with you. The pharmacist will at any Kroger, Walgreens, CVS. It is available over the counter without a prescription. So here's some information. You can text 30678 for if you want to be connected to resources. There's a Tennessee Recovery app. And in Shelby County, if you want to know about resources to get somebody into treatment, or to know about AA meetings, NA meetings, Celebrate Recovery, whatever, Lincoln Kaufman is your man. He is our Lifeline peer coordinator, and that is his phone number. Jack Wyatt is our director. That man has, let me just say that there are heroin camps on Sycamore View. If you don't know about it, that's where A Better Way does their SSP every Friday night. And there are a lot of heroin camps. Last year, when the temperature dropped to below freezing, that man went to Dick's Sports and got all these hand warmers and blankets and took it out there to those camps and helped those people. He will take anybody anywhere if they are willing to get treatment. So Jack Wyatt is the man to call. And he can also hook you up, obviously, with Narcan and or Lincoln and whatnot. Austin is our community organizer. He helps us with our SSP too. He is also helped start HA, Heroin Anonymous, in Memphis. He will help you get to a meeting if you need help, or if you want information about SSPs or what we do at MAPC. We are on memphisprevention.org. We are on Facebook, Instagram, and Twitter. Our Facebook site also has a lot of good information about what's coming up and where to go and blah, 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 blah for recovery stuff in Memphis. This is my information. I have a Florida phone number on some sites. I have a 901 number on some sites, but this is my cell number and my email number, and you can call me night or day, and people do, needing Narcan. If I can save a life, I'll go wherever and do whatever to help, because people did that for me. And Josh, same thing. And it's showing all the regions. If you are located in the 6S, like if you're in Jackson, you would call Diane Sherrod, and you can reach her through me. And if you're in Nashville, there's places all over Tennessee to get resources for recovery or for just Narcan. And tomorrow is where you pick up your kits. It's going to be an all-day festival, except it's only going to last from 10 to 2, but it's going to feel like all day. You can bring your prescription drugs that you haven't used. You're not supposed to flush them down the toilet because we have the best aquifer in the world and we don't want to contaminate it with medication. Bring it to us. We give it to the organized crime unit and they incinerate it. And you can pick up your Narcan, you can pick up your certificate if you don't want Narcan, and that will be in the parking lot at St. John's Church. You have to wear your mask. We're going to social distance. We're also going to have all the vendors out there for the stop events. So we're going to have access to treatment available tomorrow too, and a lot of fun.
All right, Jill, we have
Yep.
about 7 minutes to answer questions.
Okay, and I put the SSP thing up there. I'm going to go back to my phone number since you had that posted before.
There was a question about if they cannot pick it up tomorrow, where can they pick it up? Use our
those are your phone numbers.
and
Those are your phone numbers. We will meet you, and we can figure out a time and a place that's convenient, and we'll get it to you. I promise.
All right, and I'm putting the link to the evaluation in.
Not my evaluation. Do that one too, and the
No,
QR thing, whatever it's called.
Somebody asked if you could put the QR code back on the screen. And while you do that, is there a limited number of people you require to come to a place and do an in-service?
Absolutely not.
And that's a quick answer.
No, I'll come anywhere. I go to churches. I go to schools. I ended up doing an intervention one time with a family. It was so much fun. But yeah, I'll go anywhere if I can, or if you just want me to go talk to somebody about maybe some concerns, I can do that too. But I'll go anywhere and do some. And we do go to businesses and bars, restaurants, anywhere. And I gotta say too, I'm gonna say one more thing, and I'll be quiet and answer another question. A lot of people use drugs in parking lots. The McDonald's on Shelby, Sycamore View and Shelby Oaks has had more overdoses in that bathroom than you can count. So if you see somebody in a car at Kroger or at a Sam's or wherever, and they don't look right, grab your Narcan and check on them, or call 911. We need to save these people so they can get help, please.
Okay, here's a good question because we just got some information about this. Is there any research on the efficacy of expired Narcan?
So we have heard that the FDA has that they've extended the expiration on Narcan. On the back of your Narcan, it'll say the expiration. Usually it's 2 years from like now. But we have heard, and I'm not supposed to say legally, I don't know. As a human being, if I had it and it was expired, I'd still try to use it. Just like if I had, an EpiPen and it was expired, somebody was dying, I'd try to use it. But they are supposedly expanding this to a 3 years instead of a 2-year expiration on the nasal spray, right. Not the IV.
Okay. Does each Narcan contain one dose, or can you administer that one device more than once?
No, it's one time. When I shot this up there, that middle part that I pressed stayed up there, if you can see that. So I gave the one dose and it's done. You don't shake it. You don't, it's ready to roll just like it was when I took it out of the pack, shove it up there, boom, and that middle part will stay up and that's it. So there's 2 doses in each bag, technically, 2 4-milligram doses, which is a big dose.
Okay. One more question. My CPR has expired during this epidemic. With COVID going on, where can I go to take the CPR and first aid classes?
You can call the American Red Cross. They will have they should have a place that they can refer you to. If you Google CPR near me, I know of some nurses that have been trained that do it. I can't teach it. But there are places that you can go and do that. But I would start with American Red Cross. or CPR near me.